Hello class. Today we're going to look at athletic injuries and psychology. This is better known as the psych of injury. For a moment, think about your sport history or your activity history and answer these questions. This is about a personal injury experience that you had, what your initial thoughts were, how long you were unable to play, and how long it took you to get back from that experience. What did you learn from this experience? Did you go through some of the same processes that we will talk about later on? Or was your experience totally different? Did you touch on some of the topics that we'll talk about later? Think about this and your experiences with injury, if you've had one, as we go through this lecture. So to start, let's look at just injury and how we define injury. So when we look at psychological factors, we know that injury is not physical alone, that there are psychological factors involved in injury and the injury rehabilitation process. And these are very important factors. These psychological factors contribute a lot to what the person is feeling, what the person is going through with this injury experience. As you can see, there are more than 25 million people that are injured each year. These are just the reported injuries that are usually reported to emergency rooms or emergency departments across the United States. Now, this does not account for the countless number of injuries that happen that are not reported. So think about that and double that amount because they're not reported. When we look at injury, there are physical factors. These are the primary causes of injury. However, psychological factors may contribute to the occurrence of this injury. And injury often produces psychological responses in return as the person is going through this injury experience. Typically, people have cognitive, emotional, and behavioral responses. It's not uncommon for injured athletes to feel isolated, maybe anxious about their return to play, or depressed because they're not being able to play. These responses can influence their recovery from injury and how their rehabilitation process proceeds. When we look at this injury process, we know that injury is increased, or the likelihood of injury is increased when this person has major life stress, somewhat of a life change, or somebody that's under a lot of daily stressors. And if they don't have any good coping methods or coping strategies, these are the individuals that are more likely to become injured. In addition, issues of motivation and goal setting are often involved and often play a role in this whole psychological recovery of injury. So let's take a second to define injury. And if you look in the dictionary or look on the web or on Google, there are many definitions of injury. But for our situation, our circumstances for this lecture, we're going to define injury as trauma to the body that results in at least temporary, sometimes permanent, but usually temporary, physical disability, so somebody that cannot do their typical daily tasks, and an inhibition of motor function. This idea of injury is perceived as a very multifaceted idea in psychology and is operationalized as typically with somebody that is feeling pain. And this pain and injury needs mental attention during participation. When we look at this idea of pain, it involves the sort of loss or change in function that directly affects their performance or an athlete's performance capabilities. And typically when we feel pain in sport, the injured person has to decide whether to initiate initiate participation or continue participation, or stop participation while they experience this pain. As professionals, and my background in athletic training and sports psychology, we as professionals need to be able to tell the difference between pain and discomfort, and we need to educate our athletes on what this difference is, because pain or discomfort do not immediately accompany injury. However, if we do have pain or discomfort, it may lead to injury, or if we are feeling discomfort, it may impair our movement, which may then lead to injury as well. So when we look at injury, a good way to define injury is through the biopsychosocial view. And this view is pretty comprehensive in the factors that affect injury. And if we look at that word biopsychosocial, we can see bio meaning biological, psycho meaning psychological, and social meaning sociological or sociocultural aspects. So this view examines the influence of sociocultural, ethical, and biomedical issues on the psychological aspects of injury. It considers how psychology can help prevent and manage sport injury, and really the outcomes of an athlete's health and performance, and how these are equally important. So when we look at this idea, you can see that diagram to the right of your screen. You can see some biological factors. This is the actual injury itself, the physical part to it, where the person has tissue damage, they have increased pain, something that's physically debilitating to them. We go around to the psychological factors, where there's a decreased attention, maybe they don't have coping skills, they are scared to then return to injury or return to play because of previous injury, as well as the social factors, where there's somewhat of a disconnect in interpersonal relationships. Maybe they don't have social support, or they don't have support from their coach, as well as environmental factors. And you can see where the arrows are pointing, where each of these affect one another, and it's not just a process that somebody goes through, but these always interact with each other in this biopsychosocial view. As part of this view, there are 7 key components, and we look at injury characteristics, sociodemographic factors such as age and sex, biological factors, which is the actual physical nature of the injury, psychological factors, which we've already talked about, social or contextual factors, like I said, like social support. And then we have intermediate biopsychological outcomes, which is how much pain are they in? Did they lose any range of motion for the injury? As well as the outcomes of the sport injury rehabilitation process. Through this, it's, well, how is their quality of life? Are they ready to return to play? And these are all factors that are considered in how we manage a sport injury. So now that we have defined injury, let's look at some causes of injury. We'll be looking at a couple factors that cause injury. First and foremost, we know that injury is physical in nature. Most people even think that injuries are only physical. This is generally true. However, there are other factors that influence the physical nature of it, or may cause the physical cause of injury. So when we look at the physical nature, we know that this is the primary cause of sport-related injuries or exercise-related injuries. This could be muscle imbalances. Maybe they collide. Maybe the athlete collides with somebody else and has a collision. Maybe it's just plain overtraining that we talked about in the last lecture, overtraining into staleness. And these are the primary causes. However, psychological factors also play a role. It's been found that the psychological or psychosocial factors explain about 20% of the lost time for any one injury. So it's important to not only understand the physical nature of the injury, but also the psychological reactions of the injury for the individual athlete. For the social factor that influences injury, these have been found to be a potential cause of injury, where the athlete's perception that playing with pain and injury is highly valued, especially in society that we live in the United States. It's highly supported that no pain, no gain. And if we're not in pain, or if we're not pushing hard enough, then we're not giving our full effort. Within this social aspect, we know that males particularly need to show masculinity because sport and exercise was traditionally and still is traditionally seen as a masculine type of activity, and people need to endure pain to show this masculinity. More of today compared to the past, that both males and females adopt this value of minimizing injury and continuing to play with pain and potential injury. The third aspect is psychological. When we look at psychological, there's a figure in the textbook, figure 19.1, and it's a model of stress and athletic injury. And when we look at psychological causes of injury, really the main aspect of psychological factor is the stress that we are in. So the model in the textbook that I'll show you in a little bit, it plays a role in how athletes develop poor adaptation to training, maybe physical complaints, maybe that soreness that's starting to occur. These factors explain up to about 18% of lost time due to injury, and they play a key role in the injury rehab process. We know that stressful situations can contribute to injury, really depending on how the athlete perceives the situation. If the situation is seen as threatening, that they're scared or fear of failure, perhaps, it increases the state anxiety, causing changes in our attention and our focus, and it could also cause increased muscle tension. And these two factors, attention and muscle tension, lead to increased chance of injury. Stress is not the only psychological factor, even though that's the one that we typically talk about the most. It can include personality. So type A personality, that's always very perfectionistic. That type of personality causes increased injury or ability or to be injured. History of stressors and coping resources. This psychological stress that we have, that we continue to hold, slowly increases catecholamines and glucocorticoids, which really impair our immune function and the immune cells. And once we are impairing these cells to be generally healthy, it interferes with the removal of damaged tissue and the overall healthiness of our body. So if we continue to have prolonged stress, this decreases also growth hormones that are critical during the rebuilding process after an injury occurs, which slows down the rehabilitation process and interferes with rebuilding that tissue. And lastly, those individuals that don't have those coping skills, those coping mechanisms, or the psychological skills that we've talked about before, such as goal setting or imagery, those that do not have these skills increase their chance of being injured and increase their stress during the injury process. Lastly, we can look at a couple things part of the model. One is personality, and I mentioned this in the last slide, but when we look at personality, it's not fail-proof. We have found that there are certain factors that help somebody not to become injured, such as optimism, higher self-esteem, hardiness, that mental toughness aspect. But these are only a moderator to the stress-injury relationship, because most of the research that's been done on personality and injury, it's very inconsistent, because it's really hard to research this topic. But if we have things such as optimism or higher self-esteem, we know that, for example, if a person has high trait anxiety, the life stress relationship may be stronger than a person that has low trait anxiety. So that perfectionistic person, if they have that high trait anxiety, that stress injury relationship is stronger and may lead to injury sooner. For stress levels, when we look at levels of stress, they have been identified as important precursor to injuries. Athletes with higher levels of stress have more injuries than those with lower levels of stress. Therefore, we need to make sure and we need to ask about major changes in the athlete's life, a stressor maybe that they're going through now. Is it finals week? Is it midterm? Are their parents going through a divorce? Did they just break up with their girlfriend or boyfriend? These changes, when they occur, can have a very big impact on injury and the level of stress that the athlete is feeling. So we need to carefully monitor and possibly adjust training regimens during these times of higher stress and provide higher psychological support so we don't end up with an increased amount of injuries. We know that there's also this strong idea of social support and coping skills. When we look at the relationship between stress and injuries, athletes at a high risk of being injured had fewer injuries after stress management training. So if we are able to combat that stress level, then we take away a large percent of becoming injured if we know how to properly manage that stress. And also, if we are able to use these stress management techniques during the rehabilitation process, we have decreased time lost due to injuries and an increase in coping resources. So we don't worry about the rehabilitation program as much. We don't worry about going back into play after being injured, but we have all of these things in place to help us along with the process. We know that athletes have specific stress sources. We know that the physical aspects. These are basically pain, any treatment that they're going through, any rehabilitation difficulties, slowdowns. Then we also have more of the psychological reactions, and this is where the greatest sources of stress come from, and this is the fear of re-injury. Feeling like they've lost a part of them, feeling like they've lost their identity. Maybe their hopes and dreams have been shattered and their once scholarship is now taken away. And the fact that they're watching others perform and they can't really has a detrimental effect on them. Then we have our social problems where we lack attention. Maybe we isolate ourselves after injury. We don't want to be around sport. On the same lines as what we talked about, coping resources, a little bit more about that. We know that social support plays a crucial role in coping through the injury process. Athletes that are higher in social support have fewer injuries and less time lost than those lower in social support, and fewer injury problems occur for high life stress athletes if they have high social support. So even if we have that stress in our life, as long as we have a support system in place, we tend to have fewer injury problems. So we know that as people around the sport environment, those that are helping, those that are training, or that are possibly becoming injured, we need to be that source of social support for them. So altogether, this is what the model of stress and athletic injury looks like. This is on page 459 of the textbook. It's figure 19.1. But overall, we know that individuals with a history of many stressors, personality characteristics that exacerbate the stress response, and few coping resources will, when placed in a stressful situation or what they deem or what they perceive as a stressful situation, such as a demanding practice schedule or crucial competition, may be more likely to appraise the situation as stressful and exhibit greater psychological activation and attentional disruptions. The severity of this disruption and stressful situation results in a stress response that predisposes individuals to injury. So as I alluded to earlier, now that we know the different aspects in the stress-injury relationship, let's move more into theories that explain this relationship. First of all, we need to understand why this occurs so we can help develop effective programs for when somebody gets injured. So one of the major theories used to explain the stress-injury relationship is attentional disruption. And really, the psychological aspect of stress severely disrupts an athlete's attention by reducing the attention around them or their peripheral vision. So for example, if I'm a football quarterback and under a great deal of stress, not just sports stress, but maybe they're having a stressful time at home. Maybe it's a collegiate athlete and they're having a stressful time with classes. All of those things rolled into one may be prone to injury because they do not see the play forming in front of them and they're blindsided by a rushing defender. When stress levels are low for this individual quarterback, they have a wider field of peripheral attention, and they'd be able to avoid this sack or this defender. The second major theory is increased muscle tension. This increased muscle tension accompanies considerable stress to the body and interferes with normal coordination and increases the chance of injury. So, for example, if a highly stressed gymnast has high muscle tension, they may fall from the balance beam because they're not able to move through the range of motion as fluidly as they did before. So we know that this increased stress increases that muscle tension, and that muscle tension could also lead to more fatigue, muscle insufficiency, reduced flexibility, and motor coordination problems in their activities. So those were two major theories about attention and muscular imbalances or muscle tightness. Let's look at some psychological based explanations, and these do play a role because we know that there's such a significant part of injury related to the psychological aspects. First and foremost, acting tough and giving 110%. When coaches reward behavior that encourage athletes to play hurt or take increased risks, we are forcing athletes into a situation where they think this is the sport norm. When we have this act tough orientation or mindset, it really impacts the athlete to then play hurt and put it all out on the line. So it's important or for us to teach athletes to distinguish between normal discomfort and when you're in pain. So we need this idea in the athlete's mindset so that they are able to decipher, hey, this is actually really pain. I need to go see someone about this, or this is just mild discomfort. This is because we're training hard. Second one, if you're injured, you're worthless. Some people learn to feel worthless if they are hurt. This is really an attitude that stemmed from the athlete and how they perceive the situation. However, coaches may also convey this. Maybe they know they're doing it. Maybe they don't know they're doing it. But they do this by indicating that winning is more important than that athlete's physical well-being or mental well-being. This could be in the form of when an athlete's hurt and they're going through treatment, the coach does not visit them or check on them until they are back out on the field. So there's a disconnect between the coach and the athlete as they go through the treatment process. With that being said, sometimes the coach may also verbally say, hey, you're injured. You're not worth anything to me right now. So go find treatment and come back to me when you can play for me. So it can be very, very blunt for the person and the athlete or the coach stating that winning is more important, or indirect when the coach does not come and check on the athlete, or maybe they tell them that they are less worthy or they feel less worthy. Lastly, we have the sport ethic, and we talked about this idea of being macho or having this masculinity aspect of sport that causes injury. And research in sport norms, values, and environments has shown that when athletes are injured, the way in which athletes internalize this idea of being macho and playing with pain can lead to injury. So this macho gender belief, where I'm a man, I can't be injured, may lead to injury. We also know there's increased injury risk in different cultures based off win-loss records, based off of values external forms of success over intrinsic achievement, such as trophies or winning a championship. And this sociological aspect really, this culture aspect of sport defines success. And sometimes we have athletes that overconform to wanting those trophies, wanting to increase their win-loss record, wanting to have that extrinsic achievement or extrinsic motivation to instead of intrinsic achievement and motivation, and they over conform to the sport ethic and will do anything for that sport if they're hurt, if they have discomfort, but they will play through the pain no matter what. I think the last one that we have is injury, pain, and training discomfort. Remember, we need to be able to indicate and explain to athletes what the difference is between injury, pain, and training with discomfort. Some sports continue to be plagued with overuse injuries, something like swimmers, runners, rowers that do the same repetitive movements over and over. Sometimes coaches teach their team between normal discomfort and training as a sign of growth and progress rather than something awful or terrible. With that, normal training discomfort is not a signal to stop, but a challenge to do more. And if they have this in their mind, they may push beyond this idea of discomfort, which may lead to pain. So sometimes athletes take this philosophy too far and misinterpret what the coach means. So we need to understand the difference between this idea of pain and discomfort of hard training. Now we're going to move on to how we actually react to injury. So originally, we thought that athletes went through a similar process to a person facing imminent death or somebody that has had a great loss in their life. So this is what is referred to as the Kubler-Ross's stages of grief. And this researcher developed this stage of grief really after somebody has a family member die, and they would go through this grief response process. This includes somebody that is in denial, that goes to anger, that goes to bargaining, depression, and then acceptance. So we know that these grief reactions are widely cited throughout sport psych injury and general psychology of injury, but athletes may not have all of these responses. And furthermore, they may not go in this specific order. So the current view looks at athletes' response to injury as more flexible in general, that there are no longer this 5-stage process where one person has to be in denial first and they'll go to anger and bargaining. Sometimes an athlete may start out with bargaining and then go back to denial and then acceptance. So there is this flexibility between these stages, but we tend to see these grief response stages, but not necessarily in that order with athletic injury. So when we look at reactions, there's 3 general categories of emotional reactions. So the first one is injury-relevant information processing. When an athlete is injured, the injured athlete focuses on information related to pain of injury, the awareness of extent of injury, and questions about how the injury happened and the negative consequences of that injury. The third category that we look at with emotional responses is emotional upheaval, or how their behavior is after. So this typically occurs after the athlete recognizes that they're injured and they almost accept that they're injured, and they have behavioral and emotional reactions to it. So this may be agitation. They may feel depleted or sad. They may feel isolated, disconnected from the team. They may be in disbelief or shock from the injury process. After we we know that we're injured, we have these reactions. The third category is positive outlook and coping, and this is when the athlete accepts the injury and is able to deal with it. So they may have some negative reactive behaviors or some really negative emotions during that second category, but the third category has the athlete accept injury deal with it, and they initiate their coping efforts or positive coping efforts, and is in a better frame of mind to then deal with their injury. Now, the key to this process is that most people experience a typical response to injury, but the speed and the ease at which that person goes through the stages can vary widely. And the period immediately after the injury, is characterized as the greatest negative emotional reaction. So we need to be there at the forefront for that athlete right after they're injured. Some other reactions that we see within these three main emotional reactions is identity loss. Sometimes we have a very high athletic identity, and this is especially true for athletes who define themselves solely through sport. They don't have any other activities. Maybe they're not really good at or in academics. They hang their hat solely in sport. And for some who can no longer participate because of injury, they lose this sense of personal identity, and it really affects their self-concept. And if they don't have this part of them, then they can become stressed and isolated from others. Another reaction that we have is fear and anxiety. When we look at fear and anxiety, this is typically when we have someone coming back from injury. Many athletes have high levels of fear of anxiety or fear of failure when coming back, worry if they're ever going to come back, and if they have no practice, they have a lot of time for worry and to be scared about what's going to happen. What if they lose their spot on the team? What if they're not able to play again? What if it takes longer than expected? So these are all those fears that cause that anxiety in that athlete. And then the last reaction is lack of confidence. And when we look at this lack of confidence, when we don't have practice or competition, it really deteriorates our physical status as an athlete. We lose that confidence in our play, in the typical day-to-day performance of our sport. And if we have that lowered confidence, it decreases our motivation in rehab, and decreases our motivation to come back from injury, because we know in the back of our head that we have inferior performance, and that we're not going to be as good as we were before. Last two, performance decrements. This goes along the lines with our confidence. Because of this lowered confidence and because of missed practice, we may have a decline in performance. Athletes in general have very high expectations of themselves. So because of injury, they have decreased performance, but they have a really hard time lowering these expectations because they expect to return at pre-injury levels, and this is typically not the case. And lastly, we have group processes where the injury of one athlete can affect the group process in a team, either positively or negatively. So when we look at somebody that is injured maybe on a basketball team who can't play for 2 months, this might disrupt the flow and teamwork because maybe it was their starting point guard and now they don't know how to work together without that player. Or maybe that we have a soccer player that gets injured, and because their injury impacts the team, the other players step up and contribute more effort, which typically brings that team together more. There's an excerpt in the book about physiological components of injury. We've already talked about these physiological components because when we talked about the increased stress levels, we've talked about what happens physiologically with the catecholamines and the glucocorticoids that impair our immune cells and our growth hormones. So we've already talked about this. It's just a separate slide restating that information. So this is just a slide. We know that there's a lot of psychological responses to injury, and some of these are repeated here in how we adjust to injury, how we respond to injury, so that behavior reactions that we have. Sometimes we have mood swings. So one day we can feel really happy, we're doing well. The next day we can go in for treatment and be angry and not want to deal with the treatment. We may still be in denial. So this is just a list of possibilities of we may see with poor adjustment to injury. So here's your kind of summary slide. So review this. We know that psychological factors play an important role in injury. And everything that we talked about before with that stress injury model is very important. So when we look at injury rehab, we have to touch on each of these components in a holistic approach to emphasize the healing of both the mind and the body. With this holistic type of approach, we typically want to take a two-pronged approach within this holistic treatment. And first and foremost, we want to be able to change or help alter the cognitive appraisal of that athlete. Most times with injury, we have a negative reaction where we have negative self-talk, where we have decreased self-efficacy, we have isolation. So what we want to do at the start of injury rehab is decrease our negative self-talk and increase that positive self-talk or counteract that negative self-talk. We want to foster realistic expectations with goal setting, foster and develop a sense of belongingness, and increase our self-efficacy. And we look at self-efficacy, we know that part of that is belonging and being autonomous and being able to do things on our own. The other approach to this, so we have the cognitive aspect, but we also need to decrease the physiological arousal and enhance attentional control. Now, if you remember earlier in the lecture, these two, this arousal, which may cause an increased muscle tension, and the enhanced attentional control, are the two primary theories that lead to or are prominent with injury. The psychological aspects of injury. So we need to be able to help the athlete increase relaxation skills. That helps our muscle tension. We need to decrease our distractibility and work on concentration. And we need to keep appropriate attention and focus on treatment or rehabilitation in order to be successful. So before talking about specific psychological skills for practice and what we can use, we have to understand that one of the main functions that people use as they go through the injury process, whether it be a sports psychology consultant or an athletic trainer or somebody in the sport realm, we need to educate the athlete on what is going on. So when athletes are injured, they often deal with disbelief, frustration, anger, and we really have to build rapport, establish rapport with that athlete. This is really a reason why we ask certain questions to get their perspective of that situation. I think that this is one of the areas that sometimes is missed when an athlete is injured from the coach or from the athletic trainer, but we do not spend enough time with the individual athlete to know really what's going on and how this injury has impacted them. So in addition to building rapport, establishing rapport, we need to be a source of social support. We've talked about social support before, but we need to be a part of social support where we educate them on the injury and what is going on with the injury. The need for social support is greatest at the initial aspect of injury, as well as when setbacks occur and when that athlete goes or is attempting to go back into play. Sometimes the athlete may not know what questions to ask or what is going on, and we need to be upfront to be able to give this information to that athlete, whether it be about the injury and recovery process, whether it be about coping skills or teaching specific techniques for that athlete. So let's talk a little bit about some skills that we can use, and this is a brief background of psychological skills that we've talked about before in class. First and foremost, we have goal setting. This is really rated high in healthcare professionals, specifically physical therapists and athletic trainers. When We know that goal setting has received the most use compared to all other psychological skills, and most times we use it when we don't even recognize it. A second one is positive self-talk. And we can include or we'll include mental imagery and relaxation and kind of clump them together. Although they're important in the rehab setting, they're not used as much because sometimes we don't have this idea or the training to use thought stoppage or mental imagery or relaxation techniques. So we know that these three, even though goal setting is rated the highest, these three sections or these three areas of injury rehab are going to be most beneficial to the athlete going through this process. So when we look at the effectiveness of a person's psychological intervention following injury, evidence continues to support the effectiveness of using psychological interventions in reducing post-injury psychological consequences and improving psychological coping during rehabilitation. Specifically, these techniques have been associated with improved psychological coping and reduced re-injury anxiety, which is key for athletes to have this decreased re-injury anxiety or fear of failure when returning to play. So we're going to go through each of these, and let's talk about goal setting. So we know that athletes set goals for performance aspects, and athletes use goals on a daily basis, and they are typically very good at it, especially elite athletes. It may be a little different at a lower level, but because athletes use it so often and tend to be good at it, it is easy to transfer this psychological technique into goal setting compared to the other techniques that we'll talk about. So when we look at goal setting, we use goal setting as a strategy to enhance motivation, to complete rehabilitation exercises, increase adherence to the rehabilitation process, and really could be used as a progress indicator for that person that's going through the injury process. It really helps athletes to put their progress into perspective, and it gives them something to shoot towards for their outcome. When we look at the effective goals, personal internally satisfying goals are the best. These are not goals that have some sort of extrinsic reward, but intrinsically satisfying. They need to be measurable and quantifiable. We've talked about that before. Need to be established in an appropriate time frame, and really jointly agreed upon between the athlete and whoever they're working with. And I have the athletic trainer there, but it could be a physical therapist, it could be another member of the healthcare team. But we do use goals effectively, or if we do, we can increase an athlete's intrinsic motivation about the rehabilitation process. As part of an integrated approach to injury prevention or rehab, we can continue to use goal setting when even the athletes are not injured to reinforce the use of goal setting. Positive self-talk. Remember, as a reminder, self-talk is how we talk to ourselves intrinsically. So this is that intra type of communication. This is the effect of when we look at these statements to ourselves of really how we're thinking about that situation. And words really do change our state right now. So let's say, for example, we have an athlete that is completing a difficult rehab exercise. Typically, this athlete wants to conquer everything, but because they have a setback and this changes into a negative situation, they are having a difficult time completing this exercise because they're having negative self-talk because of this setback. This leads to increased negative thoughts, and our job in this situation, working with somebody, is to decrease this negative self-talk, and increase the positive aspects and positive self-talk. So what does positive self-talk do? It increases our motivation to help facilitate faster recovery. We don't necessarily want to speed the recovery, but we want to optimize the athlete's baseline and where they're at in that process. It also helps improve adherence to the rehabilitation process. So when we look at using positive self-talk, we want to use this type of psychological technique to optimize our healing rates, because we know that when one person is positive, or when a person is positive, they're not stressed, and we don't get the negative consequences of stress, and because of that, they tend to heal faster. Last but not least, mental imagery and relaxation. We're pairing these together because, as we discussed before, one cannot typically use mental imagery unless they are first relaxed. So we use them typically in conjunction in practice, where we have to be relaxed before we are able to imagine something. We know the definitions of imagery and relaxation, but there are certain types of imagery that we can use. When we look at these types of imagery, we have healing imagery, which is used to visualize the internal processes and healing that take place during rehabilitation. And for example, we can imagine the broken bone becoming healed, or the ends of the bone becoming fused together. This helps. This is great if the athlete has a good understanding of their injury and is able to create these images. For pain management, it's used to assist athletes in better coping with pain, alleviating pain, or remaining more positive to successfully cope with their injury. For example, we can help the athlete create images of themselves being free from pain, or having that pain decrease. We can use imagery throughout the rehabilitation process in different stages of rehab, and for example, we can have athletes complete specific tasks and skills successfully, or help them see themselves completing a required exercise, or overcoming an obstacle successfully. Lastly, we have performance imagery that we can use during rehab, and it's used to help athletes get back into play and increase confidence during that last stage of the injury rehabilitation process. So you can see some outcomes of what mental imagery and relaxation do. So it reduces muscle spasm and anxiety, increases motivation and focus. And remember, these two are the biggest proponents and theories of why injury occurs in sports. It also helps increase adherence and optimizes recovery speed. So now that we talked about what we can use during the injury process, let's look at the phases of recovery in a rehabilitation model. So each phase that we look at when somebody is injured dictates different approaches that we can or what we can use to help the person recover psychologically. Injury or illness phases focus on helping the athlete better understand their injury, and focuses on attention and helping the athlete sustain motivation and adherence to rehabilitation protocols through having this goal setting, or having this positive mindset. So we can see that these are the three phases. We have the reaction to the injury, we have the rehabilitation process, and then we have this idea of returning to full activity. So for phase one, the reaction, you can see some characteristics up there, some physical characteristics. We have the pain and swelling, the physical nature of that injury. And then we have psychological, where the athlete is panicked. They don't know what happened yet. They don't understand that they're injured. They don't know any aspects of the injury. This phase goes from immediately following the injury, or possibly surgery, to the point of when they're able to move around more, and they decrease pain and swelling. So when we look at the psychological aspect, and that's where we're going to focus, is the biggest part to this phase is pain management and helping the athlete manage the pain. So the psychological skills that we can use goal setting. We can help motivate the athlete and improve rehabilitation adherence at the beginning. We can use self-talk to help manage the pain and improve adherence. For self-talk, we need to get our athletes to talk positively about themselves. For example, we use positive self-talk with positive restructuring to see yourself beating that injury, that this injury is just a bump in the road and we're able to overcome it. Imagery is really important in this initial phase or initial reaction to injury. And for example, we can use imagery, specifically healing imagery, to help see the cells being healed and the muscles being healed. We can also use healing imagery to manage pain. A big part of using healing imagery is to educate the athlete on what is actually going on physiologically with the injury. So we need to be able to give them pictures of the injury, or possibly their x-rays or models, or use anatomical models to show them what's going on, to help them visualize them being healed from this injury. Using healing imagery helps decrease anxiety, which decreases that stress, which decreases that tension, and finally decreases that pain. So if we're able to decrease that anxiety with this healing imagery, it has a great outcome with everything else that we can decrease from it. So this is an example of an imagery script. When we put together imagery scripts during the first phase of healing, it is important to use certain words, such as we can identify pain in the color of red, or blue as more cooling, healing sensation. And these scripts that we use, and we can use these right in the clinic, or physical therapy clinic, or the athletic training clinic. The scripts could be within their typical treatment, ranging from 5 to 15 minutes, possibly when they have ice on their injury, or when they're talking with their athletic trainer or healthcare professional. And we like to use 3 parts of the imagery script. Remember, we need to use an introduction to get the athlete relaxed. So we need to take deep breaths. So we can use deep breathing or rhythmic breathing at the start. Give the point of the script. In this situation, it would be managing the pain. And then we need to use a conclusion where we are pulling them out of that image and bringing them back to the here and now. So for example, you can see it up there. Notice that after we have them relaxed, we have them notice the pain in your possibly knee. Okay, see your pain as a red sphere around your knee. See your pain drifting away as this red sphere. So we're trying to have that person imagine that sphere lifting away from their body, and then we're going to replace this sphere, this red sphere, with a cool blue sphere of healing around that body part, and in this situation, the knee. The second phase, we're looking at the treatment process of it, and for the physical aspects, we're trying to regain strength and function of that injured body part, and psychological, we are using goal setting to set rehabilitation goals, and maintaining motivation are very big keys, because we need to measure progress through this process. This is really important for longer types of rehabilitation, such as surgery, such as an ACL injury. So some of the psychological skills that we can use: goal setting. We could document the progress through the rehab progress, such as through documentation through our notes, and help the person adhere in their rehabilitation process. We could use self-talk, such as cognitive reframing and thought stoppage, to increase our motivation to change positive mindset to something, a negative mindset to something more positive. Specifically because this is where we're going to see a lot of setbacks or possible setbacks in the process. So if an athlete is struggling with an activity, we can take pictures of the athlete doing this exercise successfully, and we can then attach maybe a cue word such as power or strength, or something that's going to trigger their mind into something more positive. Or we can have positive music playing in the clinic, or have them listen to a verbal script before they complete their treatment exercises to motivate them before going into treatment. Lastly, that imagery and relaxation. We could use rehabilitation process imagery, and this could be useful if athletes are struggling with specific aspects of the rehabilitation process where they can't quite get a certain task, and we are having them imagine the task to help build those neurological structures in order to carry out that task. We can also use performance injury, and this performance injury is used because, remember, right now that person is not able to physically perform or physically practice. So we're going to use performance imagery to help the athlete maintain their sport-specific skills, whether this be free throw shooting, whether this be plays, but we can use this especially in long-term injury and still keep the same neurological structures in place as long as we mentally rehearse them. So this is an example of a self-talk script with positive affirmation statements, and this is to increase positivity in rehabilitation process, which could be used before or after a hard rehabilitation session. So these are just some statements that they could say to themselves. I will complete all rehabilitation exercises at full effort. I will control my rehabilitation success. And these are meant to empower that athlete to have a successful treatment process. Lastly, when an athlete returns to play in this final phase, we look to fine-tuning the muscles and the sport-specific skills and sport-specific tasks that they need to do. So physically, we're looking at possible other setbacks and not getting to full function. More importantly, psychological, we look at confidence level and managing fear and anxiety as they return or possibly return to play. So for example, they may worry about performance from coaches or teammates because they are nervous about re-injury or going back into play, and their play may not be as good as it once was. They also may lack confidence in their newly rehabilitated limb. They may have some lingering characteristics of pain or soreness, but when somebody is physically ready, they may not be psychologically ready. And even though we can show them that they're physically ready, they still may make excuses about returning to play and make up unrelated injuries or unrelated sensations that allow them to stay out longer because they're not confident in their ability to play. So here are psychological skills again. Goal setting. We're going to focus on goal setting for this, where we need to build confidence via our progress goals. And we've talked about progress goals, and we can show the athlete from day one and how long they've progressed or how well they've progressed. And this will help build self-confidence. We can also use self-talk to promote confidence and increase our focus or concentration by using cue words during sport-specific skills. And we can also use imagery relaxation for performance and goal setting as they return to play. So this is some statements for imagery for goal setting at that last phase. Maybe we're using these statements. Your body part is stronger and mobile. You will now take the field. Maybe we need to see ourselves competing and never giving up. We need to feel the success of all our hard work. Or your body part, whatever, your knee remains strong and moves effortlessly. Maybe if we can get that image in their head, they're not going to be worried as much about re-injury, but knowing that we can make effortless movements and not worry about our previous injury. So when we try to implement these psychological skills that we just got done talking about, there are some barriers. And when we look at obstacles to using these, one of the big ones is stigma. And there's a big stigma surrounding mental health or the psychological aspects of injury and why athletes don't seek services. And we see that research indicates that this is the most important barrier because we don't want to be labeled as crazy. We don't want to be labeled as somebody that has a problem or a mental problem. So typically, the person or the athlete does not seek intervention. Sometimes we also have that idea of athletic identity, which we talked about before, as well as the receptivity to interventions. We know that females are more receptive to than males to psychological interventions, and we know that those with prior positive experiences are more likely than those with less effective experiences to go back to psychological interventions. We also have some problematic reactions that we have to be aware of, and this could be persistent symptoms such as sleep disturbances or irritability, all the way to worsening symptoms such as being sad, leading to depression, or maybe a constant lack of motivation that leads to apathy. These are really big problems that need to be focused on in that treatment process, as well as excessive symptoms such as pain behaviors, or maybe some mood swings that you see from that athlete, or potential substance abuse as they go through the injury process. I do have referral up there. This is sometimes a barrier to having someone looked at, but know that it is one, but we're not going to focus on that as much. But let's look at adherence. Adherence for somebody coming back from injury is uh, is really key to someone being successful. When we look at predictors of adherence, we know that they play a large role, and these are personal attributes such as pain tolerance, tough-mindedness, and mental toughness, self-motivation, environmental characteristics such as social support. So we know that if we have increased social support, we're going to adhere to the injury process more. If we have effective adherence interventions, if we're reinforced, if we have good goal setting skills, and we're educated well by the people that we're working with, we are more likely to adhere. And then we have other predictive adherence such as self-efficacy, having personal control over their injury recovery really plays a role into if somebody is going to adhere to their injury process or not. Sometimes we can use a questionnaire, and we can see at the bottom real briefly, this is kind of outside the textbook, but we can clinically screen for maladaptive psychological responses to the injury process using the IPRRS, and this IPRRS is the Injury Psychological Readiness to Return to Sport. And really, it's a scale of 0 to 100 where the athlete indicates with 10 questions how likely or how confident they are at returning to sport. And if they have a score of at least 60 or above, that we deem that as being confident to return to sports. So this can help us through the process of returning somebody to sport or to play, as well as showing them the progress that they've gone through with their rehabilitation. The last couple slides here, we have some recommendations for coping that you can review. For other injured athletes, we can focus on high quality training, setting goals, and accepting and positively dealing with the situation. When we look at facilitating rehabilitation for coaches, we have to foster that coach-athlete involvement together so the injured athlete is not forgotten. Demonstrate positive empathy and support through this process, and don't repeatedly mention injury in training. And lastly, to facilitate rehab for sports medicine personnel, we can educate and inform athletes about the injury. That's our primary role. Foster a positive interaction and customize training and rehabilitation exercises, and demonstrate competence and confidence in our treatment for that person. So here are some conclusions. You can read over the conclusions, but really, we know that athletic trainers or healthcare professionals need to ensure that they are physically and psychologically ready. Most times we hang our hat on somebody being physically ready, but we know that injured athletes are emotionally vulnerable, and their emotional integrity really does change during the rehabilitation process as well as a return to play. So we cannot really assume that one that is physically ready to return is also psychologically or psychosocially ready to recover from injury. Make sure you look at these slides. This is your homework. There's a 9-question quiz uploaded on Blackboard, so you can complete this as you listen to the lecture or as you read through the chapter. The other part is complete the following kind of review questions. This is straight out of the lecture, straight out of the text, just to make sure that you're going through this information. And lastly, there are 3 videos. These are the links to 3 videos. And Michigan University has this athletic support system called Athletes Connected. And these are stories from 3 injured Michigan athletes. And what I want you to do is answer the questions and complete the worksheet designing a sports psychology injury rehabilitation program for that athlete.